half the people in this country own or work for a small business. So this is, you know, an important, critical, sort of universal challenge that we have to and that we're going to get right. We are delighted to have the leadership here today, who's going to talk a little bit about all the things that are going on, and then we're going to hear from some small business owners and some small business employees, and then we're going to be able, I hope, just to take a couple of your thoughts and comments as well. Thank you. We're very delighted to be here with you.
Good morning, everybody. I'm also really pleased to have a chance to be here in Connecticut. And I have to tell you, you are luckier than many with the great leadership who's with me on the stage today. DeLauro is an incredible leader in the House who has been not only fighting for health care for children, for affordable health care for all Americans for years, but kind of leading that effort in the House of Representatives. And Senator Dodd has really taken over, in the absence of Senator Kennedy this year, the leadership of the very important Health Committee and guided through a process of drafting one of the key frameworks for health reform. So these folks aren't just here as tag-alongs, they're really at the front of the line, and that's very good news for the whole country, the kind of leadership that comes out of Connecticut. I won't repeat what the Congresswoman and Karen Mills have already said, but in part of my one of my former lives, I was the insurance commissioner in Kansas, so I regulated a marketplace for 8 years. And I think there is a bit of a misconception that the health reform discussion is only about people who are uninsured. And certainly there is a piece of comprehensive health reform that is about the uninsured, about providing affordable health care for all Americans. But I think more importantly, it's about those of us who have insurance, stabilizing the current market, because frankly, we're all an accident away, a paycheck away, a situation away from losing our coverage. Given the rising costs year in, year out, given the fact that insurance companies now pick and choose who gets insurance and who doesn't, we are all at the mercy of what happens next. So comprehensive reform is both about providing coverage, but it also is about lowering costs and changing the insurance rules. No more pre-existing condition limitations. If you or a family member have a pre-existing condition, often you're either priced out of the market or locked out of the market. That should not happen in the United States of America, and it won't happen with health reform. There'll be a limit for out-of-pocket costs and deductibles and copays. Again, a situation which we've seen changed dramatically over the last number of years. If you have insurance, you are paying more each and every year out of pocket to buy prescription drugs, to access procedures, to take your family checkup. No copays for preventive care. We have the best sick care system in the world, but we don't have a very good health care system. We don't have a health and wellness system in this country, and one of the things we need to do for our children, for our workers, for our seniors, is begin to focus on how to keep people healthy, how to keep them out of the hospital, how to put in place incentives and ideas that we know work to keep folks healthy and not just treat illnesses when they occur. All of you who have insurance coverage are paying a so-called hidden tax. There's about $1,000 per family layered onto your healthcare costs, paying for folks who do not have healthcare, because we just shift the payment onto you. So when people come through emergency room doors and access care at a later point and a sicker point, those costs are shifted onto those who are currently paying for healthcare. And as the Congresswoman and the Administrator have already said, there is no group who stands to gain more out of a reform system than small business owners. We have a very different marketplace today. Small business owners like Kevin not only compete with folks here in Connecticut or in neighboring states, but he's in a global marketplace. And not only can he not often retain or recruit the best workers, because often workers will follow health benefits, but it's very difficult for his products to compete with a global market where the health benefits aren't layered on a product at a time. So creating a new marketplace, creating a new strategy that shares the risk in bigger pools gives not only some choice to business owners, but some competition to insurance companies. One of the features of a new reform marketplace is a public option to compete with private insurers. Because in many states, like here in Connecticut, like my home state of Kansas, one company dominates the market. So absent a public plan, there is no competition and there is no way to hold down costs. A monopoly doesn't do a very good job of cost control. So the features are in the bills that are poised to be discussed and voted on